Good afternoon, everyone. Thanks so much for joining. It's just 1 o'clock. We'll give it a minute or two before Renee and I dive in. All right. Thanks, everyone, for joining. I think we'll go ahead and get started. For folks who don't know me, I'm Allison Kretzinger. I'm our Director of Public Affairs here at the Department of Children, Youth, and Families, and I'm joined by my colleague, Renee Newkirk, our Chief Financial Officer. We, as we do around this time of year every year, will walk you through a pretty robust, the biggest set I can remember in a while, set of legislative proposals that the department has put forward for consideration in the governor's budget. We have a lot of content to get through today. We won't read all the words on the slides. We'll try to do an overview of all the DPs and ARL that have been submitted, and then we'll talk at the end about where you can find access to all the DPs to get more detail. If you want to go ahead and go to the next slide, I'd like to ground us in what guides our development process. I won't read this to you, but I think it's important to note that there are a number of factors that guide the agency's development. Most importantly is prioritizing and work and focus on our core responsibilities outlined in our mission and our strategic plan. What is going to move the needle for kids and families across the state? In addition, we have to be responsive to the authorizing environment in which we operate in. That means we have to follow the directions that we are given from our executive leaders. And this year, I think we'll talk a little bit about the realities as we go, but there was some clear direction around the economic reality that we're heading into, and that we needed to be mindful of that as we made submissions heading into this biennial budget. So with that, we can go ahead and go to the next slide. I will remind folks or make known for folks, we're using webinar format and there's a Q&A function. Feel free to type your questions in there. We'll respond to those as we go, some of them live and some of them we may type answers to. So we'll pause as we go throughout to respond to those and we may wait to the end for some. So feel free to use that function. This is an overview and a snapshot of the timeline, if you will, for how state agencies, the governor's office and the Office of the Financial Management and the state legislature intersect as we work each year to move through the legislative process. It's although the legislature only is in town for 60 or 105 days, it is a year-long process for many of us. Lots of work happening. So we're in that phase now where DCYF has submitted our budget requests and our policy requests to the governor's office for their consideration. They will then go build and review all of ours as well as everyone else's and build their proposed budget and policy platform for the next legislative session. Worth noting, and we'll talk a little bit in a bit about this, it'll look a little different this year given sort of pending transitions and changes. We want to go ahead and go to the next slide. This zeroes in on DCYF's timeline that we went through this year to build our agency request legislation and decision package. It just gives you a sense of sort of the work and the deadlines that we follow internally. Go ahead and go to the next slide and we'll talk a little bit about the realities. So the 25 legislative session starts in January. It is year one of what is called the biennial session, meaning this is a long session, 105 days, will run through April, and it's a budget setting session. So the legislature will contemplate a variety of policy bills, probably thousands of them, and they will also set the state's operating budget for the next 2 years. That operating budget will begin on July 1 of 2025. So this is the year where there's longer days, longer timeline, more being considered. Also important to note, we will see significant changes in administrations at both the federal level and the state level. For the first time here in Washington State in 12 years, we will see a new governor take office in January. We also will see a new president take office, and that both the federal impacts, but also certainly the state impacts. We also anticipate significant lawmaker change. We've seen a number of retirements, people seeking other opportunities, and expect some significant turnover in our legislative members, as well as legislative members in relationship to their roles. We saw Senate Majority Leader Andy Billig's not seek re-election, so the Senate will have a new leader, for example. All of these changes have an impact on how things move, how things work, and such. So some of this will be we'll look for as we'll learn more about as we get closer. I do want to note that we anticipate the current governor and the current administration to release his budget in late December. It is also customary that the incoming governor who takes office in January will also be building and releasing a budget. And we'll learn through that process as we go. Neither Renee and I were in these roles 12 years ago when that happened previously. With that, I'm going to turn it over to Renee to talk a little bit about the economic outlook.
Thank you, Allison. Yes, I wanted to note that based on the most recent economic and revenue forecast, the forecasted revenue for the 25-27 biennium is $71.6 billion. That represents an increase of 7.7% over the current biennium that we're in. That's the 23-25 biennium. But although that the revenue is projected to increase, it's important to note that the revenue is actually lower than what lawmakers anticipated when the budget was passed in March. It's also important to note that our current programs to operate and run the state is actually outpacing the revenue. So there will be some difficult decisions ahead for decision makers. Also noting the initiatives on the ballot in November may or may not change the revenue projected forecast as well. So there will be some challenges ahead, and DCYF did take this into consideration when we submitted our requests. We submitted the most essential and critical program services and supports. So with that, I'm going to turn it over to Allison to talk about our request in the largest categorized buckets.
Perfect. So as our requests, which began at hundreds about a year ago, began to get vetted and engaged with partners, internal and external partners, and reviewed and refined, we've sort of whittled that down to about 30-ish requests, and they fall largely sort of neatly into these 5 buckets you see on the screen. So Renee and I'll take turns sort of walking through the varying requests and buckets. As a reminder, all of these will be posted. All the DPs are posted on our website, as well as one-pagers will be posted as they are finished. So this is not a deep dive. We are not going to talk about implementation or details of anything. This is very high level. What are we asking for and why? So if we want to go ahead and go to the next slide, I will start in the juvenile rehabilitation space. Our top priority this year is continuing to stabilize the JR system and continue to grow and be responsive to that system as that population grows and changes. So the first package you see here on your screen is a safety and security package. This is both the relational safety and security measures, grievance processes, accountability infractions, restorative justice processes, new rules around that, records management, additional staff to support quality and fidelity related to classifications of young people in care, as well as this decision package also represents some of those hard or security infrastructure packages. Upgrading our communication system for residents. So residents have Securus tablets where they're able to talk to family, attorneys, et cetera, in a more real-time manner, both on phone and video. That doesn't exist right now in our system like it does in the adult system. We also have some security capacity around an investigations unit, as well as a technology systems manager to oversee the varying changes to security and technology infrastructure. I want to go ahead and go to the next slide. I see a question in the chat, Liz. I am not going to talk to implementation details. Liz had a question about the shift to Securus, 20-minute limits, cost to youth and families. I am not going to talk to implementation details. We just don't have enough time. I invite you to go sort of look deeper into the DP. I will say we sustain it at no cost. That is true of JR. We absorb those costs. There will not be a cost to young people and families. As far as time limits and such, I would, those may or may not be outlined in the DP, and more details to come on implementation. The next one I'll talk about is youth well-being. So this is really focused on additional mental health and behavioral health treatment to maintain our existing both substance use disorder services as well as additional mental health staff. We are seeing a population in our care that has really complex and needs that we need to be able to be responsive to in a responsive way and in a therapeutic way. And so this package really enhances and builds on some of the great mental health work to date, as well as expands our opioid use, our reentry focused opioid use disorder program. I think JR is really proud, and I'm really proud to promote the fact that JR offers developmentally appropriate drug treatment and the public health approach and in best practice. And so want to be able to continue that and expand that, given we know many young people who come into our care have struggled with substance use in their history. This also does a few things related to discharge and reentry planning, really, and quality assurance for some evaluation protocol, really ensuring we're ready for that implementation of the 1115 waiver, as we'll be in an early adopter cohort around some of that Medicaid service and Medicaid billing coming into facilities to support those smooth transitions to reentry for young people. We want to go ahead and go to the next slide. The third decision package in this space really contemplates the expanded employment and education for young people in JR. It's true that the population is getting older and the education and employment needs are changing. We've had a huge focus, rightfully so, on access to secondary education and invested heavily in education teams at both of our secured facilities, as well as out in our community and our regions. We need to expand that so it covers that post-secondary world as well, that post-secondary education, post-secondary employment, certification programs, et cetera. In addition, we need to expand the offering of vocational programs that exist. So this decision package does a variety of things aimed at expanding programming and expanding access to that programming for young people who are in that post-secondary phase of their journey. Go ahead and go to the next slide. We are asking for resources to begin the process to bring an electronic health records management system to DCYF. We currently do not have an electronic health records. We maintain records, but they are not in a comprehensive electronic health records. And this is a requirement as part of the 1115 waiver process, and is really about sort of best practice when we think about records for young people and healthcare history being easily accessible to them, stored safely, but easily accessible to them and in one space that they can easily get and receive when they transition or leave. So this is a technology ask largely. We want to go ahead and go to the next slide. We have a placeholder decision package, an operating placeholder decision package, really contemplating expanded secure residential settings. As folks who are familiar with the space know, we have seen a growth in population that has led to an overcrowding challenge at both of our institutions, more prominently at Green Hill. And one of the things we've actively been doing is trying to identify, are there additional spaces that DCYF could potentially lease and operate and sort of expand our secure residential footprint. So we have this in here as a placeholder, no action yet. For folks who have been involved in this conversation, we have explored a variety of options and looked at a variety of places, and we'll continue to do that. Nothing has materialized, although some are further in conversation than others, but really want to have space in case something does materialize and we are able to bring on, a smaller ENT mental health-like unit or expand our residential footprint. The other thing I will note, we have a capital ask on the JR side. That is the first step in citing smaller residential facilities. So this is not an operating ask, it's a capital ask, and it's this first step in more community-based secure residential setting. So moving to that 16-bed model, moving to that, sort of more of a 16-bed model, if you will, for residential settings. So first step in that process, which is a pre-design process. That will be a longer arc on the capital side. And if we want to go ahead and go to the next slide, we have one piece of agency request legislation in this space. As part of our security upgrades in our secure facilities, we have started using body scanners for staff, for visitors, and for residents. And we want to make sure, like in other settings, other secure residential settings where body scanners are used, we have the same public records protection for those body scanners or those sensitive images to be protected, except in cases when young people request them. So asking for a piece of agency request legislation to make clear that those images, those sensitive images, are protected and non-disclosable. And with that, I will turn it over to Renee to talk through some of the prevention and adolescent services stuff.
All right, thank you, Allison. I appreciate it. Yeah, so as Allison noted, I'll begin with our prevention requests. This first request, our secondary prevention that we are requesting through community pathways. There's 2 community pathways we are requesting funding for. That is our family resource centers and plan of safe care. So we're requesting to use our family resource centers, I'll refer to them as FRCs, to support high-need families with children to prevent them from becoming involved in the child welfare system. And we'll use the plan of safe care pathway to support pregnant people who are in the need of SUD treatment, as well as treatments for substance-exposed infants. So you may be familiar with House Bill 1227, the Keeping Families Together Act. This modified the removal standards, and we are seeing the intended impact of reducing out-of-home placements, which is great. However, we are seeing an increased need for more preventative services. And so with our family resource centers, how we plan to utilize them, first I'll note that the FRCs are place-based organizations. They provide a single point of entry for a range of services that anyone in the community can access. FRCs may provide services such as information, they may assess needs, make referrals for family services, and they may even provide services or maybe contracted out services. And then our fentanyl epidemic is impacting child safety, unfortunately. So that's where we're requesting some SUD resources through the plan of safe care pathway. With both FRCs and plan of safe care, we would like to increase the access needed to prevention services, as I noted, for our high needs families in the high needs communities across Washington, especially those areas that are at the highest risk of child abuse and neglect. Also, where there's high numbers of Black and Native children entering out of home care. Okay, we can go ahead and go to the next slide. Home visiting. The 23-25 budget provided funding for us to support provider wage increases and cost increases for our home visiting providers. We have implemented rates for some of our models. However, there's funding needed to implement rates for our remaining 2 models, the nurse family partnerships and parents as teachers. And with implementing rates, this is where we will support the provider wages and cost increases. This request is also requesting to maintain the additional slots that we received through Senate Bill 6109 in the 2024 supplemental budget. These contracted slots for home visiting are slots that are in our high-risk communities, offices with disproportionate out-of-home placements for Black and Native children. We can go ahead and go to the next slide. We are requesting combined in-home services quality improvement, as well as a new service, PIP, which is Positive Indian Parenting. So we're requesting these quality improvements in our upfront child welfare system known as combined in-home services. And specifically, we're requesting to include and embed motivational interviewing training, which is an evidence-based program, into our family prevention services model. And this is to ensure the high quality intervention. And we're also asking to extend the duration of the service so that families can receive the full benefit of the motivational interviewing. We are also requesting funding for concrete goods. It is known that child welfare families who receive concrete goods are 17% less likely to experience subsequent child maltreatment than families who are not receiving concrete goods. So those are really critical needs for our families, and we're hearing that need. We're also requesting funding for transportation costs. So as providers visit with families and it's known that there's a concrete good that's needed, sometimes it's a really critical emergent need for a concrete good. And so providers are delivering the concrete good immediately to those families. So we're requesting in those cases for transportation, mileage reimbursement and such to be reimbursed to providers. The request also includes culturally responsive consultation. So we'd like to have our providers have access to a consultant who can help guide, mentor, coach how they may adapt their curriculums to the unique families that need the cultural needs of our families that they're serving. We're also requesting funding for the Positive Indian Parenting Program. This is a parenting program. It's a 10-week parent education program developed by the National Indian Child Welfare Association. So the goal is, again, to reduce out-of-home placements, increase number of providers providing culturally specific prevention services. Okay, we can go ahead and go to the next slide. Our CSEC and victim advocacy. CSEC is commercially and sexually exploited youth. Unfortunately, based on the Washington State Office of Crime Victims Advocacy, there's reported an increase of 400% of reports of human trafficking between the years of 2022 and 2023. So therefore, we're requesting funding in this area. We're requesting funding for 2 CSEC receiving centers, one on the east side, one on the west side. And we're also requesting access to victim advocacy for services for our identified youth who need those supports. We're also requesting a position for a missing tribal youth locator, specifically to locate, connect with youth, attempt to bring them back to care safely, specifically for those tribal youth. Also requesting support for a robust, consistent statewide system of screening and assessment for all reports of trafficking. Okay, we can go ahead and go to the next slide. We're requesting funding to support our adolescents. So adolescent services, specifically 2 areas, our independent living program and the LifeSet program. Both of these programs are critical and necessary as they support our young people as they're exiting care, supporting them in transitioning to independence and adulthood. Our independent living program is a voluntary program. It's available to youth, young adults from the ages of 15 to 22, but also noting that eligibility is established once a young person has been in dependency for 30 days. Once they've been in dependency after 30 days between the age of 15 and 17, they're eligible. And then they're eligible to receive services up until their 23rd birthday. And the IL services are provided by community-based providers and tribes. Services include employment assistance, education, financial management, daily living skills, vocational training, emotional support, etc. We received funding for the independent living program, an additional $750,000 one time for fiscal year 24 and 25, which is the fiscal year that we're in now. It ends June 30th. That was one time for those 2 years. So this request is just a continuation of that $750,000 per fiscal year so that we can maintain current level of services and providing the current number of youth, young adults that we're providing services to today. We're requesting funding under the LifeSet program. This is an expansion to 2 additional counties. We currently provide services in 6 counties. So this is a request to provide the additional 2 in Clark County and Pierce County. And LifeSet, it's an individualized program. It's developed by youth villages. It's designed to empower and assist young people ages 17 to 22 who may have been involved in foster care, juvenile justice systems, behavioral health systems, to help them improve their lives, become more independent, transition them into adulthood. And these specialists help our young people with support such as finding housing, provide financial literacy and education, improve their mental well-being, employment supports, etc. So both of these are very valuable and critical adolescent services that we've requested funding for. Okay, we can go ahead and go to the next slide. DS compliance. This request was submitted as we continue to meet the agency's obligations under the DS settlement agreement, which was reached with plaintiffs in a class action lawsuit filed on behalf of youth in the state's foster care system who were experiencing instability. So seeking stability for those young folks in foster care. So with that, we need some additional resources to ensure that we're continuing and improving on the placement stability. So we have requested under the Emerging Adulthood Housing Program as required under the settlement that supports housing statewide for 16 to 20-year-olds. It is referred to, our program under that is ATLP, Adolescent Transition Living Program. So we are requesting an additional 10 beds, 5 beds in Region 4 and 5 beds in Region 6. We are also requesting additional beds under group receiving care. That's an additional 12 beds, 6 in Region 4, 6 beds in Region 6. And these beds serve children under the age of 12, also to accompany siblings up to the age of 18. We are requesting an additional 10 beds under the exceptional placement services. And these beds serve youth ages 12 to 17 with moderate to high level needs. And then we're requesting a new placement type, intensive group receiving care. This is an additional 6 beds. This would serve children ages 12 to 17 with the highest level of need. And the goal with this is to really so we can phase out the least facilities that the department is currently utilizing. And we are with that, we're requesting temporary funding just to continue the use of those exceptional placements, those leased facilities, until we're really fully able to phase them out. But in the interim, some temporary funding is required. We're also requesting a rate increase for group receiving care that is in Region 3. So I also want to note the group receiving care additional 12 beds that we're requesting for Region 4 and Region 6. That is at the same rate as the rate increase requested for Region 3. There's other supports that we're also requesting funding for DS compliance, our plaintiff legal fees. There's fiscal resources to ensure that we can get those payments out on time with pay points as required under the settlement agreement, as well as a resource for data research and implementation manager to support the system improvements as required under the settlement agreement. Okay, we can go ahead and go to the next slide. Our extended foster care incentive program. The extended foster care program, as you may know, are when a young person reaches the age of 18 and they're dependent, they may voluntarily choose to continue receiving foster care services. Previously, prior to Second Substitute Senate Bill 5908 passing, in order to enroll into this program, young adults must meet federal eligibility requirements. And those eligibility requirements are things such as they're enrolled in high school or a high school equivalent program, enrolled in post-secondary academic or vocational program. They're working, they're employed 80 hours or more a month, those sorts of programs. And so what 5908 did was it removed those federal eligibility requirements, really truly making this a youth choice program. So any youth turning the age of 18 when they're dependent may choose to continue receiving some foster care services. With that, the bill also indicated that if a young person is actually in one of those federal eligibility required criteria, if they meet that criteria, then we are to develop an incentive program and pay those youth a monthly payment. We did not receive funding for that, so we are requesting funding for that incentive program to make a monthly payment of $150 beginning July 1st, 2025 to each of those EFC youth enrolled in one of those federal eligibility required activities. We are also requesting additional funding for concrete goods. Now, this request is currently in the extended foster care program. Youth are eligible to receive up to $3,500 over their duration while they're enrolled in the extended foster care program. However, now with this becoming a youth choice program, we are requesting funding for the additional population, the additional caseload of those youth now enrolling and choosing to enroll in the extended foster care program, that we can provide them with that same level of concrete needs. And we're also requesting with the anticipated expected caseload expansion, more youth opting into extended foster care, we need the caseworkers to fully support this casework so that we're supporting our young people. Okay, we can go ahead and go to the next slide. And I'm going to turn it over to Allison to discuss the remaining two child welfare related decision packages, as they have agency request legislation as well.
Thanks so much, Renee. Talk about two exciting pieces of agency request legislation as well as decision packages. The first being community-based family reconciliation services, or FRS. For folks who are familiar, we submitted a decision package on this last year and unfortunately did not get funded. And so we're back again, as things often take a few years, this time with a bill that really outlines our intent and what we're working to do. There has been a number of years of community partner work, internal and external partner work to co-design, reimagine and co-design what family reconciliation services could be and could look like. And part of that set of recommendations was really moving that work from inside DCYF, inside sort of the child welfare or CPS division, to community-based partners that have a different orientation and a different relationship with families. And so this year, our funding and our bill really outlines the three regions in which we're calling the early implementer regions or early implementing regions, and outlines in statute sort of the how we want to get from where we are to where we want to go to have a statewide community-based family reconciliation services program available. So we're excited to bring that forward. And if we want to go to the next slide, the next piece of agency request legislation I'll talk about is called what we're calling conserving public benefits. A couple of years ago, there was a proviso that directed DCYF to begin some work on understanding the impact of public benefits that young people and children in out-of-home placement or out-of-home care get, like survivor benefits, disability benefits, supplemental Social Security income, etc., that they may get for whatever reason they're eligible for. It is current practice from Washington State and many other states and jurisdictions across the nation that agencies who are in care and custody of young people when they're in, or children when they're in out-of-home placement, will apply for those benefits on behalf and then use those funds to reimburse themselves for the cost of care. This is, again, common practice. And I describe this as one of those moments when you know more, when you know better, you do better. And that's exactly what this is attempting to do, as well as many other states who have, well, I should say a few other states and jurisdictions who are sort of on this journey with us. Really what the goal here is to take those benefits, those financial resources that are intended for that child or that youth, and preserve them for them or conserve them. And then that young person, when they exit care, would have some choice autonomy in that. So this bill outlines doing that, directing us to stop reimbursing ourselves, but also outlines the process by which we need to have in place to protect those benefits, right? So the legal framework, the protection framework, so those resources are in accounts that are safe, that are stable, that when children and youth exit care, they would have access to. And then the funding to do that, but also the funding to sort of fill the gap between what the state is reimbursing based on these benefits. So that sort of concludes the child welfare and adolescent space. There have been a few questions in the chat. I've been able to answer those, or in the Q&A, I've been able to answer those in writing as Renee was going. So with that, we can go ahead and go to the next slide. I'm going to talk about a little bit about our early learning space. A distinction here, I'm going to talk about 3 early learning decision packages that are part of the maintenance level set of requests, if you will. This is a technical piece, sort of behind the scenes. Some things are maintenance level when it's just the maintenance of, and some things are policy level when they're new. So everything else that Renee and I've talked about today sits in that policy level space. The reason these that I'm going to talk about are maintenance level, because they are expectations or requirements in current law, and we are simply submitting the decision package to say the current law says X and the cost of doing X is Y. So childcare subsidy rates, these are the rates reimbursed to childcare providers for eligible families in licensed childcare. The state law requires that the reimbursement rate is at the 85th percentile of the current market rate survey. We redid the market rate survey, or updated the market rate survey. Update, I guess, is what I was trying to say there. We updated the market rate survey in 2024, so we have a new one. So we're obligated to tell the legislature how much it costs to pay the rates based on the new market rate survey. I will note this decision package is specific to the cost of those rate increases for center-based care and outdoor nature-based early learning. Family childcare providers rate increase the same, moving from the 21 to the 24 market rate survey, 85th percentile, is in the collective bargaining agreement that exists between family childcare providers and the department, family childcare providers being represented by SEIU 925. We want to go ahead and go to the next slide. So much like the rate conversation, there is a current law that says in 2025, July 1, in fact, of 2025, the new eligibility for working connections for financial assistance to offset the cost of childcare for families expands from where we are today to 75% state median income. There's a cost to that. That makes about 6,000 new families eligible. So this is our sort of report to the legislature, or our invoice, if you will, to the legislature to say, to comply with that law, it's going to cost X. And so that's what this will do. It will increase the working connections. It will also eligibility. It will also increase, as required in law, the dual language rate based on an inflationary adjustment. And then there are funds in here which are very important for outreach. So making more families eligible is great. Families need to know they're eligible. And so we're asking for some outreach resources to be able to do targeted and appropriate outreach for communities across the state so families know that they're eligible for this updated benefit. We want to go ahead and go to the next slide. Also, maintenance. This is the biennial budget when the ECAP entitlement comes due. When the law goes into effect that says if you are under this income threshold and you want an ECAP slot, you shall have it. And so we need about 6,000 slots, 6,500 slots to reach the projected number of entitlement. So this decision package asks for those. In addition, it asks for a rate increase. We need sustainable ECAP rates to ensure that providers can afford to hire staff, retain staff, and operate in a high quality, developmentally appropriate way. So this has about a 29% rate increase for ECAP slots, as well as I noted, additional slots. We continue to request conversion. We really believe that working day, full day and working day slots, or school day and working day slots, meet the needs of families, but also provide that dosage that is going to yield a return to get us to kindergarten readiness outcomes and kindergarten readiness for children in ECAP. And so we continue to ask for conversion of slots. There's also a small amount of resource here to ensure providers have what they need to continue the quality elements like curriculum, ongoing assessment, etc. I'm going to go ahead and go to the next slide. We now have 2 additional early learning related decision packages. These are policy level decision packages because they're not sort of in current law, if you will. But the federal government, which administers the Child Care Development Block Grant, which we are the state recipient for and has a whole set and host of rules and regulation and best practice measures, released a new set of requirements for states who receive CCDF or CCDBG funds. And so this is the cost of compliance with those for all providers and families that are engaged in the Working Connections childcare and in licensed childcare. So a couple key elements I want to talk about. This will include continuity of 12 months of Working Connections benefits. So previously, the benefit began when you were deemed eligible, and sometimes there's a gap from when you're a family and you're eligible for that childcare and when you start utilizing that childcare. This clarifies that the benefit is really when you start utilizing that childcare for 12 consecutive months. Additionally, the new rules from the feds, which we're very excited about, align childcare subsidy payment practices with the private market realities. So currently, childcare subsidy payments pay retroactively or on a reimbursement system based on attendance. What this new reality will mean is that providers are paid proactively based on an enrollment, much like the private market reality. I had a child in early learning. I wrote a check at the beginning of every month, and I decided to take him on Tuesday or not, but I still paid for Tuesday. And so that is how the private market works. That is what providers need to sustain business. That is what families need to ensure predictability and consistency and availability. So we are excited about these changes. I will note that we do have some outreach and communication dollars because this is going to be a big change. There are going to be different rules, I don't want to say monitor, but how we monitor this and are in compliance with laws and audit requirements, et cetera. So we're going to need to train childcare providers, our staff, everyone on what this new reality looks like. And so we do have some one-time costs for outreach, communication, contracted training, et cetera, for providers who participate in the subsidy. There is also a technical change here related to overpayments for families who are approved under presumptive eligibility when federally required. So there are some limited requirements around overpayments, and this clarifies you only seek overpayment in these certain scenarios and situations. So these are great changes to help stabilize the childcare market, and there's a cost to doing them. I want to go ahead and go to the next slide. The last early learning decision package before I turn it over to Renee is a decision package in our licensing unit to really separate out our licensing work, our ongoing monitoring, our technical assistance philosophy approach first from our investigation when there is a complaint process. So we have done this in foster care and group care, and we have seen the impact. And so this is really asking for a specialized team of licensors who are really only doing that sort of investigation when there are complaints and really taking that part of the reality off of the sort of ongoing monitor. So there is a question I'll cover really quickly related to ECAP. Will the prospective payments cross over to align with ECAP? That's a great question. The decision package is specific to licensed childcare, and I am not totally sure how the ECAP billing practices work at this point. So we are not asking for changes to the ECAP billing practices or payment realities, so those will stay the same. And with that, I will turn it over to Renee to talk through the remaining decision packages.
All right, thank you, Allison. So this next one, child welfare and JR forecast, this is a really technical but important request. I wasn't going to go there with maintenance level versus policy level, but Allison went there, so we'll go there. So forecasts are submitted as a maintenance level request. So a maintenance level request means that this is the cost just to maintain current programs. So the cost may increase, decrease, fluctuate based on caseloads, but maintenance level forecast in general means, or maintenance level request in general means that it's the cost to maintain an existing current program. So the Caseload Forecast Council, they forecast entitlement caseloads. In child welfare, foster care is an entitlement caseload. So entitlement, I'll use the federal definition of entitlement, sort of my casual definition, if you will, is that if a client or person is eligible for a service and the service is allowable, then the federal government will fund it. So I use that as a comparison, utilizing entitlement. So with the state, it's similar in that we typically, I don't want to say always, although in my experience it always has been, but I don't want to say that, we receive funding through the forecast. And with funding through the forecast, costs are tied to a caseload, and we wouldn't then therefore need to submit a separate request for funding for a particular program if that program is included in the forecast. So I hope that that's clear. I'm not sure if it is. Feel free to put a question in the chat if it's not. But for child welfare, what we're requesting, as I noted, that the foster care caseload is part of a caseload that is forecasted by the Caseload Forecast Council and therefore an entitlement caseload. Not all of our foster care services are included in the forecast. There are a couple placement types, such as our EPS and ATLP, that are not included in the forecast. So whenever we have some additional needs, we need to submit a separate request for that, versus if it's through this process, we can tie it to caseload and request it through a maintenance level request. And then our other services, just to give a couple examples, like foster care respite, transportation, those are all within the suite of foster care services, but they're not included in the forecast. So we're requesting for all of our foster care services to be forecasted. And we're also requesting for our caseworkers to be forecasted. Currently, we only have our CPS caseworkers that are forecasted. We're requesting for all of our caseworkers to be forecasted as well. In the juvenile rehabilitation program, slightly different request in that in order for us to receive funding through the forecasting process, the formula for that is we take the caseload and we multiply that by a rate. So in most cases, it's a per capita rate, but in the juvenile rehabilitation program, it's a marginal rate. And that marginal rate is $37,000. It is very, very outdated. It's based on data from like the 90s, maybe even the 70s. So it's very, very outdated, does not fully cover the cost of care. And so we're requesting to transition from that 37,000 marginal rate to a per capita rate. And so then we'll take the caseload that the caseload forecast council forecasts for JR are those in residential facilities, so our community facilities and our institutions. So we would take that population, multiply it by a per capita rate, and then that equals what we would be funded through our maintenance level forecast request. So right now, what we're working on is in that per capita, we want to fully cover the cost of serving a young person in JR. So costs such as education, programming, medical, as well as the staffing required. So counselors, security officers, etc. We really need this to cover the full cost. Right now, it doesn't. So that's what we're requesting here. There's the agency request legislation, as well as a decision package for JR specifically with child welfare. There's not a decision package, just requesting to move existing services that are provided by the department in through the forecasting process and would be adjusted based on the forecast. So with that, we can go ahead and go to the next slide. Risk mitigation, we're seeing an increase in our tort claims filed against DCYF. They've doubled between fiscal year 23 and 24. So requesting some additional supports here. We're requesting litigation FTEs to support the increase in tort responses. We are requesting additional FTEs for practice quality, additional FTEs to support our family practice model. That's the goal, to improve the quality and intention of practice. So we need additional resources to both support the increase that we're seeing in tort filings, as well as resources to improve our practice to reduce future tort claims. We're also requesting funding for de-escalation training to our child welfare social workers, as that's a much needed need of ours as well. Okay, we can go ahead and go to the next slide. I have two sort of IT related requests to review. The first is our DCYF Enterprise Payment Solution. We refer to this as DEPS. This was previously known and referred to as our SSPS replacement project. There is a feasibility study that's wrapped up, nearing completion, and once that feasibility study is completed, we will have a better idea of how much it will actually cost us to replace the SSPS system. The SSPS system is a critical system to us, as it provides and generates invoices and payments to providers, supports tax reporting, it generates letters and notification documents to our payees, as well as other functions. So it's more global than a payment system. So it's really critical for us for this to be replaced. Okay, we can go ahead and go to the next slide. And we're requesting continuation of funding for our CWIS system. The CWIS system is our comprehensive child welfare information system. This is a case management system in child welfare. We received funding through fiscal year 25 for implementation However, this solution will take 4 more years to complete and to implement. So we're requesting funding to continue implementing through fiscal year 30. With this system, it will allow us to claim federal FFPSA. So FFPSA is a federal funding source under Title 4E. Title 4E is an entitlement program. So as I described through the forecasting decision package, an entitlement program, as long as our clients are eligible, services are allowable, we will receive the funding. Under FFPSA, this allows us to claim federal dollars for certain specific preventative services that are currently not allowed under traditional 4E, but they are allowed under the 4E FFPSA. But with FFPSA, in order to claim those federal dollars, we have to have specific data sets to report back to the federal government, which we do not have today in the current case management system. So it'll allow us to leverage additional federal dollars for much needed prevention services. Also, this technology, under the current technology, we're unable to make updates to comply with new laws and court decisions and such. So developing a system that allows us to modify it and meet our social worker needs as well in managing the case. So that's what that request is for. And I think that was the last decision package to review. That was a lot. So our decision packages are currently posted on DCYF's Government Affairs webpage. As Allison noted at the top of the call, her team is working on one-page summaries of the requests, and they will be posted to our website as they are completed. But Allison, I'm going to turn it back over to you. That's your team working on those. So if there's anything else to add.
Exactly right. The only thing I'll add is the webinar recording will also be posted on that website if you wanted to go back and review it, as well as the slides or share it. So yeah, that covers our content. Sorry, I missed the date. When would the family replacement be implemented? It's phased and modular. So I don't know, Renee, if we want to go back one slide, or Renee, if there's a date there.
Yeah, I don't believe that it can be phased in. After talking with our IT folks at one time, we thought that would be the case, but implementation will be fiscal year 30, currently slated for completion of June 30th of 2029. So then implementing that July 1st of 2029, which is fiscal year 30.
The big project. All right. Well, thank you so much, everyone, for joining. You know how to get a hold of Renee and I, and things will be posted on the website as they're completed and ready. And we really appreciate your engagement. Please reach out if there's questions. And I hope everyone has a wonderful Wednesday afternoon.